Hi, my name is Abby Gully, and today I'm going to be performing my head-to-toe exam. Here's my blank rubric, and my patient's already signed the back of the consent form. Knock, knock. Go in. Wash my hands. Hi, my name is Abby, and I'm going to be your nurse today. Can you please tell me your name and date of birth?
Kim Gully, 5/20/71.
Okay, is it okay that I call you Kim?
Yes.
Okay, great. So today I'm going to be performing a head-to-toe assessment on you. I'm going to be inspecting your eyes, ears, mouth, skin, heart, lungs, and abdomen. And if any point during this exam you have any questions or need me to stop, please let me know. You've already told me your name. Can you tell me where you are today?
In Winchester.
Okay, what time of day is it?
It's morning.
Okay, great. So my patient is awake, alert, and oriented ×3. I'm going to start by taking your blood pressure. Do you have a preference over which arm I use?
I don't.
Okay, I'm going to use this one. Let me palpate your brachial pulse to see where I need to place my stethoscope. So you're going to go under your arm. I'm going to place this pillow under your arm so that your arm remains at heart level.
Okay.
Okay. Your blood pressure is 120/70. Is that normal for you? Okay. Great. So I'm going to put this over here out of the way. Let me take this and put it back up here. So I'm going to first inspect your eyes. I can see that your eyebrows and your eyes are symmetrical. Your eyelashes are full. Your sclera is clear, your cornea is clear. Can you pull your bottom lids down for me? Your conjunctiva is pink, and your eyes are moist. Okay, you can relax. Next, I'm going to be looking at your pupils. Just look at me. Okay, follow this light. Okay, I'm going to take my pen light and go in towards your nose and back out. Just follow it with your eyes. Okay, your pupils are 4 millimeters and they are equal, round, and reactive to light accommodation. Next, I'm going to be inspecting your ears. I can see that they are both round and symmetrical and tan. Your left ear has no lesions or deformities or drainage, and your left ear has no lesions, deformities, or drainage. Next, I'm going to be inspecting your mouth. I can see that your lips are pink and moist, and they don't have any cracking. If you will, open your mouth for me. I'm going to shine my light. Okay, see that your mouth is pink and moist. If you will, stick your tongue out and say ah. Okay, lift your tongue for me. Okay, and pull your lower lip down. Okay, I can see, you can relax. I can see that you have healthy teeth and gums. You have no missing teeth, and no cavities, and no lesions, so that is good. Next, I'm going to feel up your carotid pulse. And that side is 2+, and this side is 2+. I'm going to feel over your trachea. Your trachea is midline. Next, I'm going to pinch a little bit of your skin to check your skin turgor to see if you're dehydrated or not. Okay, you have brisk skin turgor, so that is good. If you will, stick your arms out straight for me. Inspect your arms. Okay, they are tan, even in color. They are free of bruising, lesions, vascularities, scratches, insect bites. Let me fill of them. Back some arms. Okay, they are cool, dry, and smooth. If you will, squeeze my fingers. Okay, your hand grips are 5, which is great. And feel of your radial pulses. They're 2+ bilaterally. If you will, stick your fingers straight out for me, looking for clubbing in your nails. I don't see any in the left or right. Next, I'm going to check your capillary refill. Each nail is there as should be, and your capillary refill is less than 3 seconds, so that's great. Next, I'm going to pull this up and check your lower extremities. So, in your lower extremities, your color is tan and even. Your skin is cool, dry, and smooth. I'm going to check for pretibial edema for 5 seconds. Okay, you are free of edema. You have toenail polish on, but if you didn't have it on, I would check your capillary refill in your toes, and it should be less than 3 seconds. So I'm going to check your dorsalis pedal pulses. They are 2+ bilaterally. If you will, push down on my hands. That is checking your plantar flexion, and it is 5, which is great. So I'm going to sanitize my hands. If you will, swing your legs up on the bed for me. Okay. Next, I'm going to check your heart.
I missed my cup rubber.
It's all right. So I'm going to listen to 5 different sites, and when I get to the 5th site, I'm going to listen to your apical pulse for a full 60 seconds.
Okay.
First, I'm going to listen with the diaphragm of my stethoscope, and then I'll listen with the bell of my stethoscope.
Okay.
And I can see that you are free of heaves or lifts. So the first site is right sternal border, second intercostal space, aortic, second intercostal space, left sternal border, pulmonic, third intercostal space, left sternal border, Barrett's. I'm going to lift your shirt and keep you covered. Fourth intercostal space, left sternal border, tricuspid, and then midclavicular line. Fifth intercostal space, midclavicular line, mitral. I'm going to listen to your apical pulse for a full minute. Okay. So now I'm going to go back through and listen with the bell of my stethoscope, but you have a regular rate and rhythm. Your apical pulse is 60, and I can hear an S1 and S2 at each site. And I don't hear any abnormal sounds such as murmurs or splitting. I'm going to go back through and listen with the bell. Second intercostal space, right sternal border, aortic. Second intercostal space, left sternal border, pulmonic, third intercostal space, left sternal border, verbs. Lift your shirt again. Fourth intercostal space, left sternal border, tricuspid. Fifth intercostal space, left midclavicular line. I'm going to listen to your apical pulse again for a full 60 seconds. That's mitral also. Back down. You can go ahead and sit up for me.
Okay.
So your apical pulse is 60. Have a normal rate and rhythm. S1 and S2 are present, and I don't hear any abnormal sounds such as splitting or murmurs. So next, I'm going to listen to your lungs. If you will, take a deep breath for me. Okay. Your breathing is symmetrical. I'm going to listen to 6 points on the front, 8 on the back, and then 1 under your arm. So whenever I place my stethoscope, if you will, take a deep breath for me. Deep breath. Deep breath. Okay. So if you will, can you turn for me so that I can listen to the back? Okay. And I've got to raise your shirt. Is it okay for this portion that I'll leave you uncovered?
Yes.
Okay. I'm going to pull your shirt up.
Okay. Is that okay?
Yes, that's fine. Deep breath. Deep breath. Okay. Deep breath. Okay. Perfect. Thank you. You can turn back around for me. So your breath sounds are clear. I can hear breath sounds throughout. I don't hear any abnormal sounds such as wheezing, rales or rhonchi, so that's good. Next, I'm going to inspect your abdomen. So if you will, lay down for me.
Do I need to lay flat or is this okay?
That's fine.
Okay.
Leave that like that.
Okay.
I'm gonna pull this down just a tad.
Okay.
See everything. Okay, I'm gonna look across your abdomen. Your skin is tan and even. Your contour is round. I see a few scars. What are those scars from?
From previous surgery.
Okay.
Yes.
And I see that your umbilicus is midline. I don't see any deformities or drainage. So,
There's a scar there.
Okay.
From surgery.
So what I'm gonna do first is listen to your bowel sounds. Okay, I can hear bowel sounds present in all 4 quadrants, and it is normal active. Next, what I'm going to do is I'm going to palpate your abdomen.
Okay.
So first, I'm going to palpate with one hand, and if you feel any tenderness, please let me know.
Okay.
Any tenderness?
Mm-mm.
Okay, so with light palpation, no tenderness, no masses, no abnormalities. Now I'm going to palpate with 2 hands. If there's any tenderness, please let me know because I'm going a little deeper.
Okay.
Any tenderness?
No.
Okay, so with deep palpation, no tenderness, no guarding, no masses or abnormalities. If you will, you're going to stand up for me now.
Okay.
Just stand up.
Okay.
We'll lay this over here
Okay.
for now. Okay. So now I'm going to inspect your spine. I'm going to pull your shirt up again for this portion.
Okay.
Are you okay with it?
Yes.
With you being uncovered? Okay.
Yes.
So I'm going to inspect your spine. I can see that it is straight. I'm going to palpate down both sides. Any pain or tenderness?
No.
Okay. Can you lean forward for me a little bit? Okay. I don't see any signs of scoliosis, kyphosis, or lordosis. And if you want to, you can have a seat.
Okay.
That concludes our head to toe exam. Do you have any questions, comments, concerns?
No.
Okay, thank you.
Thank you.